Hi, my name's Tim, and I'm going to be doing a presentation on adolescent psychosocial changes in development and in relation to the family with a clinical example. So we have Dara. She's a 14-year-old Caucasian female. She has an 11-year-old sister. Her parents recently separated and are getting a divorce. Tensions are very high between the parents at the moment. She lives with her mom and her sister at her mom's house, and then she and her sister visit their dad every other weekend. Both homes are large multi-bedroom, bathroom homes, and both have in-ground pools. There is no smoking at either home. Mom is a radiology technician and dad is self-employed. Dara has celiac disease that was once very well controlled. However, between becoming a teenager and the divorce, she has not been following her celiac diet and has been having episodes of constipation and headaches recently. Dara has always been a straight A student, but her last semester of school, her grades did slip a little. Dara is a competitive soccer player and practices approximately 15 to 20 hours a week. Her mom is very active in church, and when the kids are with her, they attend church frequently. She has more of an authoritative parenting style. Dad is a non-practicing Christian and uses an authoritarian parenting style. Both Dara and her sister recently started counseling to help with the divorce. So first we want to take a look at the different psychosocial development theories that are applicable for the adolescent group. First, we're going to look at Erikson. And at this stage, for him in adolescence, adolescents need to develop a sense of identity as opposed to role diffusion. The adolescent will begin to see themselves as unique individuals. They decide, or they start to develop the sense of where they're going to be heading in the future. Now, the idea of group identity versus alienation, peer groups are extremely important. Become extremely important during the adolescent time period. So it's necessary for the social development of an adolescent to have peers or peer groups versus isolation in order for them to develop their psychosocial sense of identity. The adolescent will strive to attain autonomy from the family in order to develop this sense of identity. And it appears that group identity is essential to the development of personal identity because young adults are going to have to resolve the questions concerning the relationships they have with their peer group before they're able to resolve questions about who they are in relation to the family and society. Role diffusion is going to result when an individual is unable to formulate satisfactory identity from the multiplicity of aspirations, roles, identifications, etc. Um, you're going to notice that the adolescent will dress, um, do their makeup, and listen to the same types of music and talk like the people that they are hanging out with in their peer group, and that's part of the whole group identity. And for Erikson, the quest for identity is representative of the adolescent time frame. They're extremely aware of their bodies. This also plays a role in the development of an identity, and they start to take into account directions they hope to take into the future. It can be possible for adolescents to find it too easy to slip into the roles expected by others without incorporating their own personal goals or questioning any of the decisions that are made for them. Thus, it's important for, thus individuals may become what parents or others wish them to become based on these premature decisions. Confusion, depression, and discouragement can result if role diffusion results. The process of parents providing models for coping during stressful encounters is extremely important. Sex role identity is also extremely important for Erikson and the identity versus role diffusion. Adolescents this is a critical time for them to develop sexual identity, how they perceive their bodies. They're going to start finding out or discovering what sexes they are attracted to. And one of the important tasks of adolescence is to incorporate sexuality successfully into close, intimate relationships. So they'll begin to form their sexual identity. Many teenagers begin to make a shift from relationships with same-sex peers to intimate relationships with members of the opposite sex during middle adolescence, which is where our person Dara is right now. The other theory here, Piaget, with cognitive development, is the final stage where the adolescent emerges into operational thought, which means that they can imagine a sequence of future events that might occur, including college and occupational possibilities. They can imagine the consequences of their actions. Their thoughts can be influenced by logical principles rather than just their own perceptions and experiences. And they can detect logical consistency or inconsistency. For instance, if the parent demands honesty but cheats on an income tax report. And they can also begin to consider both their own thinking and the thinking of others. Now this is important also in relation to Dara, because at the moment she is facing the fact that both of her parents are presenting with different parenting styles, but we'll get back to that. So in family systems theory, family is viewed as a system that continually interacts with its members in the environment. Problems or dysfunctions do not lie on any one member, but rather in the types of interactions used by the family. Thus, the interactions and not solely the members are viewed as sources of the problems. A change in any one family member creates a change in any other family members. The family is the patient and is the focus of care. The strengths of this theory is that it's applicable for normal everyday life. It's useful for families of various structures and stages. However, the limitations is that it's more difficult to determine cause and effect relationships. The family stress theory, the families encounter stressors, events that cause stress and have the potential to affect a change in the family social system, including those that are predictable, such as parenthood, and those that are unpredictable, such as illness and unemployment. Stressors are cumulative, simultaneous demands from work, family, community life, etc. Too many stressful events within a short time period can overwhelm the family's abilities to cope. A state of crisis can occur, and it's not necessarily detrimental, but the family must be able to make changes to adapt to the situation. Duvall's developmental stages of the family. There are 8 of them, but essentially marriage and independent home, the joining of families, that's the first part. Second stage is going to be families with an infant, then preschoolers, then school children. Teenagers, families as launching centers, middle-aged families, aging families. Now we're going to compare some different parenting styles. First we have authoritative and then we have authoritarian. With authoritative, emphasize reasons for rules, negatively reinforce deviations, allows child to voice objections to family standards, respect individuality of child, control is focused on the issues, not on withdrawal of love or fear of punishment. Parental control is firm and consistent but tempered with encouragement, understanding, and security. Authoritarian style is a parent tries to control their children's behavior and attitudes through unquestioned mandates. I do it because I say so. Um, Punishment may be stern withdrawal of love and approval. If close supervision and affection are not provided, the style may be associated with both deviant or defiant and antisocial behaviors. And we saw, and we'll get back, I'll review the situation with our clinical family. But what we saw is that the mother has an authoritative parenting style and the dad has more of authoritarian parenting style. And this can be an issue because Dora and her sister spend most of the time at her mother's house being used to an authoritative parenting style, and then every other weekend when they go spend time with their father, he's going to have an authoritarian parenting style, and that's going to be very confusing for Dara and her sister because of the lack of consistency in the parenting style. So that might be something to bring up to the parents to discuss once we get to anticipatory guidance. A little to review on parenting and divorce. It's estimated that more than 1 million children experience divorce each year. Because a function of parenthood is to provide for the security and emotional welfare of children, disruption of the family structure often engenders strong feelings of guilt in the divorcing parents. During a divorce, parents' coping abilities may be compromised. And this is going to be what we see as an issue with Dara's parents as we go through and look at the examples more. Parents may be preoccupied with their own feelings, needs, and life changes and may be unavailable to support their children. This can be an issue with Dara's parents as well because they are recently divorced and separated. And it could be affecting Dara if the parents are having their own issues to deal with and looking to establish new relationships and having to work. And, there might be some things to ask them is how much time are they spending at work? Or are the parents going out, trying to meet new people and establish those new relationships to help themselves there? And as we'll see here, newly employed parents, usually mothers, are likely to leave their children with new caregivers alone after school or in strange settings. So this might be something to bring up with Dara's mother when you do talk to her in the office. A parent may spend more time away from home searching for new relationships, like I said before. And this could have numerous effects on Dara. Obviously, Dara may have more time away from supervision to be doing things that are high-risk behaviors. So that's something to ask Dara and her mom, maybe together or separately. Single parenting, just sort of quick review of here. This majority are women. Children raised in female-based headed households are more likely to drop out of school, be a teen parent, and experience divorce in adulthood. Managing shortages of money, time, energy is often a concern. Many single parents have trouble arranging for adequate care, particularly a sick child. This is just a review of the family unit that we have in our example here. Um, just to pick out the important things that Dara's parents both work. She lives with her mom and sister most of the time. Every other weekend, she goes to live with the father, who has the different authoritarian parenting style. It's important to know Dara's 14, so she's in that middle adolescent period. The parents are divorced. Tensions are high between the parents. Um, the mom is active in the church. The dad is a Christian, but he's non-practicing. That's important for spirituality too, where nurses are in a good position to discuss spirituality with the adolescent, and just go over that with them. It is notable that um, spirituality is important in middle-aged adolescents who may be contemplating or participating in risky behaviors because greater levels of religiosity and spirituality are associated with protective, health-promoting behaviors, especially for youth living in environments that lack positive influences. And that's according to the source that I have from Wong's Essential Pediatric Nursing from Hockenberry. So even though her father may not be an active practicing Christian, we do know from this, we'll get to the strengths, but we do know that she comes from a spiritual background, so that could be helpful and some information to follow up on. So here is the strengths and weaknesses. So the weaknesses: parents have different parenting styles, tensions are high, parents are recently divorced, single parenting. I will note here something I found interesting. The parents are not involved in the theory or in the therapy. It said that Dara and her sister are in the therapy. So maybe it might be something to ask them if, if we do view this as from the lens of a family systems theory, it could be beneficial possibly if we could get the family to sit down as a unit for therapy. Some of the strengths here are them. Dara lives with both mom and sister. They're not all separated, living with grandparents or something like that. Dara is a firstborn. That could be viewed both beneficial or non-beneficial. Dara and sister visit father every other weekend. Both parents' homes are large and have pools. I mean, that's got to be nice. You would suspect they must not be living in poverty, at least from what you can assume from that. There's no smoking at either home. Both parents are employed. We'll take that as a strength just for the purposes of income and providing for the children. Dara is active in soccer. That gives her a peer group to participate in. The mom is active in church. We already went to discuss that. Both Dara and her sister recently started counseling. We just discussed that. So in relationship to the Duvall, our clinical family here, it appears to be in stage 5, families of teenagers. Some of the tasks for them is going to be adolescents developing increasing autonomy and sense of identity. Parents will be refocusing on midlife marital and career issues. Parents begin a shift toward concern for older generation. Dara is a teenager and her task is to develop a sense of autonomy and identity. Her parents have the task of working through midlife career, marital and relationship issues, and that's just the evidence for them being in that stage. I have a lot of questions in follow-up for this family that I would be asking. There's a lot of important things to consider here, like are the grandparents around? Are the parents aware of the slipping grades and the fact that she's not following her celiac diet? If Dara were to be sick or hospitalized, maybe from her celiac disease, how would that affect the family? What resources would they need? How close do the parents live to each other? Are they far away when they have to drive there on the weekends? Have the parents considered going to family therapy? How much does the mother work? There's a lot of things I'd ask. Make sure also there's never any drugs or firearms in the home, but that's more around health related than I would say psychosocial. Also, bullying is a thing to be considered here. Make sure that they've not been bullied. Does Dara party? Is she having more time to do risky behaviors because her mom's not around? So something to look into. So I did have a journal article on adolescent anticipatory guidance, and it stresses using the head's mnemonic for things to go over with the adolescent and the family. in regards to anticipatory guidance. You see here it's head, home, education, employment, activity with peers, anxiety, appetite, drugs, depression, delusion, suicide, safety, sexuality. And Dara, we know, has issues with school performance, so I put the quote up there from the article. Quote, school performance and more importantly, changes school performance and involvement are markers for multiple health issues, unquote. It could be good to have a time alone with the nurse to allow the adolescent to discuss some confidential, embarrassing matters. Priority anticipatory guidance. We want to use that heads mnemonic, make sure we address all of those, but priority here for Dara's situation, it's going to be important to discuss with her parents the risk for and the signs and symptoms of depression and suicidal ideations in adolescence, because we know that that is something that does occur frequently in the adolescent age, and it can happen without the parents being aware of it, just because of not being aware of the signs and symptoms. And because of the fact that Dara had the issues with school and with not following her celiac diet, these are just some things that could potentially be signs and symptoms we want to be on the lookout for. The nursing diagnosis of Dara is ineffectively coping, related to the divorce of her parents and change of family structure, as evidenced by slipping grades and not following her celiac diet. Some parents may find handouts of anticipatory guidance to be helpful, and some may prefer electronic material. That's from the journal article. He found that people had different preferences. He also said to create a conversation with the clients and not just go off a sheet. So you need to empower her to express herself and provide her with resources to help her with her coping. As you can see at the bottom, I put their risk for depression, suicidal ideation, because her grades are slipping, blah, blah, blah. And she just may have some underlying mental health issues. We just need to make sure that we properly investigate and we provide them with all the information and resources they need to cope with that. And that's it.